we'll talk a little bit about kind of the broader spectrum of services or kinds of therapies that are available that are outside of the classroom. But we wanted to make sure that we gave you some things to go away with today that can be helpful in terms of classroom and for the student, but also reducing that load on staff, right? That's always the kind of combination that is necessary. So we always like to start out our presentations by giving some gratitude to those who have taught us. So we have learned from the wisdom of many, many different people in the field of neurotherapy. There are a lot of different kind of perspectives that are followed in this field. And this is a list of the people who have influenced us either by actual hands-on training or in the research that they have provided to the field that really influences the way that we think about using neurotherapy as a way to optimize brain health. But most often we get this question all the time: is there any research on this? Because we are kind of on the cutting edge of mental health in terms of the kinds of therapies that we might provide. And so we get met with skepticism often, and we appreciate it and have gotten to a point where we don't any longer list off all of the studies because we know they're out there. So the answer to the question, is there research, is yes. So last time we looked, which was about a month and a half ago now, on Google Scholar, not just Google, but Google Scholar, there were over almost 4 million studies on electrical stimulation. And so, yes, the research is there. This slide is just giving you a little bit more detail about some of that research. And like we look at it with in terms of case studies for neurofeedback or studies that have been done, peer-reviewed studies for neurostimulation. And also audio-visual entrainment, which we're going to spend a good amount of time talking about this morning. So we cannot ask a child to focus if their brain is physically stuck in a state of survival. We must first provide the biological bridge from chaos to calm. That's really what we want to talk with you about this morning, is how we go from that place of a child who is experiencing and then interacting with their world from a place of kind of survival mode and chaos and the anxiety that comes from that, and what we can do to reduce that and to make it more accessible for them in terms of learning and just interacting socially in the world. Your students, you know this as educators and as parents, that your students carry a profound brilliance, but many of them also carry a profound weight, and that is the weight that comes from trauma, comes from childhood developmental trauma. It comes from living in a system where they're oftentimes led to believe that how they are as individuals is not correct, trying to fit into an education system that has one idea about learning, and if that doesn't fit, then they're left feeling like an outsider, like they don't belong, like they're not good enough, like they cannot succeed. You see all of that in the classroom: disruptive behavior, emotion regulation issues, oftentimes shutting down, disconnecting, those sorts of things. In this nervous system, this is really a state of survival that is happening. And so that's really what we want to talk about, is really shifting the perspective. And how schools have this tendency, and even as parents, and I say this because I am a parent myself and know that I've been guilty of this at times, that this idea that behavior, if it kind of doesn't fit into my expectation that it's bad behavior, there's something, that kid's doing something wrong, there's something wrong with the kid, they're not following rules, that sort of thing. And so we're inviting you to think about this in more of a biological perspective, a nervous system that is in survival mode, and it shows up kind of up the chain as those behavioral things that we see: the inattention, the shutting down, the disruptive behaviors. We can't teach a heart that does not feel safe, and we cannot reach a mind that physically is stuck in a storm. So this slide is really talking about that idea of shifting the lens from just plain focus on behavior to also focusing on the biology. This is the critical piece. And so we think about kind of more of the traditional classroom, and even though there has been improvements in areas, this still shows up on a regular basis. This sense of like when a kid starts to not fit into the classroom norm, they are considered like a disruptive student, right? I just was talking with a woman this morning who was talking about a 6-year-old, like a kindergartner, they're telling her he's got signs of ADHD and they're starting to say he might not be able to stay at this school. That because, and they don't have the staffing likely, right? That's part of the issue. But there's also this kind of perspective that if the child can't do X, Y, and Z this way, here's how we respond to it. And sort of we give whatever services we can, but there's a disciplinary piece that happens here. And that's the piece about your child's not going to be able to stay in this school, some version of that. And so it's a very reactive approach to dealing with children who are experiencing the dysregulation that comes when they are in survival mode for whatever reason that might be. And so one of the things that happens, we'll talk a little bit more about this, that when the nervous system is in that survival mode, a whole bunch of things start to happen in the brain that make it impossible for a child to do the things that we are then asking them to do, to just calm down. Even to ask them to take a breath sometimes is like impossible for them to do that, not because they're not willing to or they're being willful or they just want to, the system. It's because their system is dysregulated in a way that isn't allowing that to happen. And so the goal then is to get that system regulated so that they can start to engage in some of those behaviors, those skills that we might be trying to teach them. And so we're going to talk with you about that idea of kind of moving to this idea of a neuro-informed shift. So really kind of thinking about, okay, when this kid is behaving in this way, what might be going on from more of the biological, and for us, it's, nervous system, central nervous system, autonomic nervous system. What is going on that may be leading to those kinds of behaviors? And so we're going to take a look at some of that. This slide really shows kind of the movement and the from into this idea of kind of neurotherapy or neuro-informed education. But it highlights kind of the synchronicity here, the idea of there are indigenous practices like smudging and drumming, reflection, that really are focused on helping that individual center their mind, right? And in many ways, what we're doing in using neurotherapy is the same thing. We are just working with regulating the brain with the same goal of being able to get the mind into a space where it is more centered and then can engage in life in a more productive, more effective way. And so again, it's that idea of moving from a reactive classroom or environment to something that is more of a proactive environment. We'll talk about the how to do that in a little bit. So I'm going to talk with you about a couple of bits of research that come from Daniel Siegel, who's a neuroscientist who's taught us a lot about how the nervous system works and a lot about what kind of how trauma can impact it. And so this hand model, I think, is it's such a great model because it's so very easy to understand. So if you just look at the hand that's up there, there's a few things to look at. So he refers to this idea of the brain stem, as the downstairs brain. So the brain stem is the part of the brain that is responsible for kind of survival things like breathing and heart rate and those kinds of things that we don't really think about. They just happen, right? And then tucked inside here in the palm is the limbic system. So this is kind of the big feelings area, right? This is where the brain experiences emotion and all kinds of feelings there. And then tucked above that is what Siegel would refer to as the upstairs brain. That's kind of the wise owl. It's the cortex of the brain, part of the brain that allows us to actually do the thinking so that we can use logic to problem solve. If I'm feeling really scared, if I can get upstairs, right, if I have access to the upstairs, that upstairs can say to me, find somebody who's safe to talk to, or pull out that worry stone that you have in your pocket and hold on to it for a little bit, or take a deep breath, or whatever it might be. But the problem can be that if that nervous system gets too overwhelmed, so when it gets overwhelmed, sometimes what can happen is it can flip its lid, right? And so that's what the open hand over here is showing, is this idea of when the nervous system gets overwhelmed in that way, it no longer has access to the wise owl, because one of two things is going to happen. It's either going to become hyper aroused, right? So we might think of that as fight or flight. Now, fight and flight, it's not all bad, right? Times when you want arousal to happen, right? To keep you safe and to keep you alert, keep you thinking and doing the things that you need to do. But it's context dependent, right? And so if I'm in a classroom and I have a history of trauma that is influencing my brain kind of staying in a hyperarousal mode, that's no longer helpful. It's not functional at that point, right? And so that can happen, or the kind of hypoarousal, which is the shutting down that can occur. So Siegel talks about this. Talks about this in great detail. So if this is of interest to you, find some of his information and do some more reading about it. So the idea is, if we flip into the hyperarousal or the hypoarousal, what's happened then is we start to get flooded with, our brain starts to get flooded with stress hormones like cortisol and those sorts of things. And that can impact the brain's ability to access that cortex, or the wise owl, right? The part of the brain that engages in logic and can help me, like if I'm scared, to go to those problem solving things to find something that's going to calm me down. Instead, I can't reach that, and so I end up staying in whichever direction my system has sent me, right? So hyperarousal in a kid looks like acting out behavior, inattention, emotional dysregulation, really disruptive emotional regulation issues, fighting, right? Those kinds of not being able to get along with peers and with adults as well. The hypoarousal is more of a shutdown. So this is the kid who looks either like they're spaced out all the time, dissociated, interested would be one of the old ways of thinking about this. This is a student that doesn't show any motivation, right? When in fact, it's quite possible they'd be motivated if they could just get out of the hypoarousal place, right? And then Siegel also talks about this idea of the window of tolerance, which is really about kind of the area, the zone in which a person, their emotion regulation is able to be handled effectively without getting hyper-aroused, without getting hypo-aroused. And so the whole idea of the theory here is that we have this kind of zone where we need optimal arousal, so not too much and not too little. Enough arousal is going to help us to engage and motivate and do the things that we need to do to problem solve, right? Or to engage in classroom activities, to do my homework, that sort of thing. When we get out of the zone, either to the hyperarousal, which in this image is shown as the rocks, kind of that, if you think about that, that's the rocky behavior, the kind of overactive nervous system. Or if we're over in hypoarousal, which is more of a dissociated, again, sort of this stagnant way of living, either of those areas, then we lose kind of capacity to be able to engage in activities, because we're either shut down or overactive, and that pulls us away from that kind of optimal arousal area that would allow us to effectively engage in emotion regulation. So we can use all of this information to help us understand, first of all, what might be going on, to maybe take a different perspective on what might be going on with a kid who's not showing up in the way we would like them to show up in the classroom or in another environment. And it can inform us as to what we might want to do to help that child. Now, if this, as I've been saying, is biological, right? So it's not just behavioral, but it's biological, the cause of it, then we're going to have to address the cause if we actually want true change, right? We know from forever the studies that started about punishment and how ineffective that is in actually creating any kind of learning at all, right? And so we really have to get to this spot of being able to address this cause. And so the question becomes, how do we do that? So that's what we do in our clinic day long, all day long, every day. We are working with people to kind of optimize their nervous system functioning by working with the brain, by working with the autonomic nervous system. So we're talking, this slide is talking a little bit and moving into talking about audiovisual entrainment. So I want to just show you this device, and many of you have stopped by our booth, but if you haven't, please take a look at it. This is an audiovisual entrainment device. I want you to notice a couple of things. First of all, notice how portable this is, right? This can be taken anywhere. It can be used anywhere. Notice how non-disruptive it is, right? You literally put on some goggles and a headset, or just the goggles if you're needing to be in a classroom and listening, right? You could just use the goggles. That's a powerful part of the entrainment. Somebody can use this to start regulating their brain. I'm going to show you in a little bit an EEG of somebody, and I'm going to show you how quickly their brain waves can move from fast beta waves into slow, calm alpha waves. And we'll see that in just a couple of minutes. So Guy is just showing you. So Guy could be sitting there, like he could sit for the rest of the presentation here. He could actually do his part of the presentation with that on if he wanted to. And they're built in, the protocols are all built in there. So it's just this wonderful device. And what it's going to do is, there's a couple of things. You'll notice that there's pulsating light. You can see that in the glasses. What you can't hear is there's also pulsating sound coming through the headset there. Pulsing at a particular brainwave frequency based on whatever protocol we have told it to run, right? And then what's going to happen in the brain is what you see in step number 1 up there, something called the frequency following response. It's actually going to, as the stimulus, like the pulsating light, hits the optic nerve and neurons around there, like neurons start to follow the frequency that they're being given, right? And so in a short amount of time, the brain starts to just do that frequency. It's like, think about the rhythm of a drum, right? That's what's happening here, right? Is the brain is just picking up that rhythm and the neurons are starting to engage in that rhythm. And so within a very short amount of time, oftentimes like within 5 to 7 minutes, you can take somebody who's in like what would be the equivalent of a full-blown panic attack, which for kids looks like acting out behavior, right? But it doesn't look like what we see in adults with panic or in many adults with panic. But it within 5 to 7 minutes, it can calm them down where they can hear what's being said to them and can start to then engage in some kind of interaction and communication. That's kind of the thing that starts to happen. And then as that's happening, there's also ear clips that you can put on with this that do cranial electrical stimulation. So basically increasing cerebral blood flow. So that's the car wash up there, right? That idea of kind of bringing in more oxygen to the brain as well, which is just going to allow the brain to function smoother. And then all kinds of data about what is going on with audiovisual entrainment. I'm going to talk quickly and run through some of that quickly because time is running fast. About the kinds of, as the AVE starts to stimulate neurons, we see increases in things like serotonin and melatonin, a significant regulation of cortisol. If you have too much cortisol, it's a stress hormone and it's good when we need it, but if you have too much in there, it's going to impact you. And if you have too much in there over time, it actually is going to have a really negative effect on short-term memory, on working memory as well. And so that starts to regulate. So it's creating this lovely environment for the brain to be able to start to do the tasking of whatever it is we want. Settle down and listen to the teacher, read the book, engage, kindly with your classmates, whatever it might be, those sorts of things. And so it's really kind of that bridge builder that we see that can work significantly well. I'm going to scoot through some things. These are some of the slides about the research studies. So yes, there's research. I'm just not going to go through them in too much depth right now because I need to get that up here. This is just also showing how somebody who is engaging, trying to do heart rate variability feedback is having a difficult time. And the minute that the AVE gets put on, you notice the change in blood volume in the finger. That's a positive thing. And so very quickly starts to happen. More research on the positive effects on the autonomic nervous system, basically enhancing stress resilience, which is key, right? It is key for children in school, and especially Indigenous kids have they've got a lot more that they're fighting against. It's got a pretty immediate effectiveness. I said 5 to 7 minutes. It lowers cardiovascular risk, which is actually a bonus. Here's some more studies on that. We'll, if I see some of you taking pictures or information at the back of the room, we'll send you copies of the PowerPoints as well. Yeah, that way you can save some phone space. So this is again the idea of really kind of building that bridge from a dysregulated nervous system that's purely in survival mode to a place of calm or engage in. And when I say calm, I don't mean just always like just chill, like where you can be effective, right? In terms of your focus can be spot on, your motivation gets improved because everything is kind of working a little bit more in sync. Again, kind of building that bridge, just for the sake of this. We put this slide in here. This was back, when was it, Guy? 2000, 2001, I think, the Minnesota study, where they actually did a study. The person who developed the ABE device that we have did a study with a school in Minnesota and found some amazing results using ABE in the schools. And unfortunately, when that teacher retired, you all know what happens, right? Somebody who's kind of spearheading a project, if they go, the project does not continue, right? Because there needs to be somebody else that's passionate enough to do that. And oftentimes that isn't the case. I want you to pay attention to some of this because that I think is really significant information, right? What they saw was significant improvement in behavioral things, but also in things like reading rate, jumping up. This was a 3-month study. This is, they did this in 3 months. First grade one grade level jump for those participants. This is just kind of breaking up a little bit into the genders. I think there were 39 students in the study. I think 21 of them were male and the rest were female. And so you can see some of what's happening here. I apologize. There's some wrong in some of these slides, but basically what we see happening is improvement on the TOVA scores, right? So lots of improvement in terms of ADHD types of symptoms or struggles, but also a lot of improvement in social interaction, and the universal classroom changed as a result, because you all know this, when students can get calmer and more settled, so can the teacher. And then everything goes much better that way. And so there's that kind of that domino effect. Yeah, I'm going to move through this. There's so much we could talk about. So this is just giving you an example of some of the, there's a protocol called the Brain Brightener protocol. There's a category of them. That would be for a student who is maybe sort of in the shutdown mode, and we want to get them optimized a little bit more, which they're, if we've got a student who is kind of on the hyper arousal end, we might give them, there are some mood booster things we might give them. We might give them an alpha, like the 10 hertz protocol, as a way to kind of get their brain more into of kind of more of a calm state, so that they can regulate their behavior easier. So a study of a couple of students, not the names of the actual students, but we have Leo and Maya. You can see what their clinical diagnosis was, what they were struggling with, and then you can see the difference the changes that happened. And it gives you an idea of how you can start to engage with using audiovisual entrainment as a resource in the schools. For Liam, he did a home session. He would do a 20-minute session at home before he went to school as a way of getting him really to start kind of calming. So when he got to school, he was kind of set to go, right? His anxiety was lessened a little bit and he was able to engage a little bit better. And she needed to use more of a calming strategy. So things like alpha protocols, sometimes a sub-delta can be helpful in that way. But notice that the difference here is oftentimes they're giving her during the school day, pulling her out into a resource room, although we have some teachers who have been starting to bring these into the classroom as well, which would be my advocacy. It's I think every student could have one of these on and learn much better. But and just kind of do a post-lunch reset for her, get her calmed down again so she's ready to go. She was a nurse goer. This is how her behavior showed up. Significant reduction in that. Whereas Liam was more noticeable in terms of his homework increases because he could focus better. So again, that idea of kind of moving from chaos to calm and the idea of part of the idea is to really kind of look at like the wisdom that we have had for many, many, many years, that idea about kind of centering and the importance of that in terms of function. And that's all we're doing here is bringing neurotechnology. Yes.
So both sides.
Yes.
Can that figure out a way like calm everything?
Yeah.
Because he's got all the I can't do the homework, I can't focus on anything, but also the I'm not awake and I'm not.
So here's one of the awesome things. So like I was talking about that 18 hertz protocol, right? And sometimes we'll use low beta wave, which is it working now? We'll use low beta wave and they're meant to help with focus, right? So that would hit that ADHD part. But as the brain starts to regulate, then some of those other pieces start to fall into place, right? And so everybody that has stopped by our table and used the AVE has said to me, and some of them I gave brain brighteners, right? So we're energizers. So we're energizing their brain, literally putting high frequency, getting their brain going to focus. But when they're done, they say, I feel so calm. Right. And that's because of the device itself has different mechanisms in it, and sometimes, the right side will be doing an 18 hertz and the left side will be doing a 10 hertz, which would address exactly what you just said. Yeah. So I'm going to show you this. I want to point this out to you. This waveform here, you see how kind of short and close together it is. This is beta wave, right? And so we had this person wired up and just had him just sitting there kind of just thinking about his day, right? So I'm going to play this and you're going to start to see the waves get taller and wider apart. That's alpha wave showing up. And we're going to see how quickly this happens. So we're watching beta. I'm watching beta move, but you aren't.
Yeah, feel those in her.
You do? You have those?
I think I work for Pacer Center. So we got all kinds of tech.
There we go. Excellent. There's beta wave or alpha wave showing up already. And we're 39 seconds in, 38 seconds in. So you're seeing a little bit of the alpha show up and then there's a lot more beta. So just imagine the student that's sitting with this on, right? They're probably not beta, but high beta going because they're all revved up. And then we're going to there's more alpha waves showing up. And then what happens over time is this just starts to become alpha wave. Like it's just beautiful, right? It's just this lovely symphony. Yeah, look at that. Look at that. And look at this. We're a minute and 12 seconds in and the brain is already changing, right? And thank you.
And can I just say, I think what's beautiful about it is the student doesn't have to bring anything to it. It's not like they have to think, ooh, alpha. No, it just modulates their brainwaves.
Yeah, it does. And they can just be sitting and doing nothing, or like I said, they could be sitting in the classroom listening, and that's just doing its thing. And it's gonna just even if they wanted to try and stay distracted, it's going to move their brain into that frequency, right? So I think you're right, Tammy. That is part of the beauty of it. Thank you. All right, I'm going to pass this on to you here. This is just a couple of images of kids using this. I meant to show you kind of how user friendly it is, and the kids really tend to like it, right? Every once in a while you get a kid who gets a little bucky about using it, but there are ways to get children to do things. And so that's, this is an example of that. So a couple of testimonials from people, Dustin up in Red Lake, they bought a few years ago now, started using it, same in Dream Technology or Technical Academy is using it. Got a lot of schools that have these in their resource rooms now. And if you're interested in finding out how to do that for your school, stop by our table. We're in the main vendor hall, and we'd be happy to talk with you, happy to walk you through that process. And I'm going to call you out. Tammy has been just instrumental in helping us with understanding how to help schools get these into their schools as well. I'm going to be quiet because I want to give you some time to talk. So, I think this is where you come on.
Fantastic. Thank you. Okay, so maybe let's just take a moment, have everybody stand up. We don't have a whole lot of room or a whole lot of time, but let's just take a moment and just give a little shake. Get a little bit of movement, a little bit of blood. Change. We've been sitting and listening for 30 to 40 minutes. So, okay, wonderful. Thank you. Go ahead and have a seat again. Just to kind of help connect what Fran was talking about, what I'm going to talk about. How many of you maybe read in the car? When you're a passenger in the car? Anybody? We've got a few people that read in the car. Great. So that's probably fine if you're going down the interstate at 65 miles an hour. It's nice and smooth and you're reading. It's great. But then it's time to turn off. And you know those side roads, those washboard side roads? Have you ever tried to read on one of those, right? It doesn't go so well, right? Now, did you suddenly lose the ability to read? No. Right. So you could just think about the road. This is your nervous system. When you're on a nice smooth road, you can read fine. Get onto a washboard side road, can't read. Your ability did not change. So this is what we do with the nervous system, is we just help regulate the nervous system to get it running nice and smooth, and it lets people have access to the capacities they already have. So that's kind of our thing, is we kind of feel like we come in before a lot of the things that we do that are on the side of behavior to help optimize the system to be able to produce the behavior. The behavior you want is to read. You need a smooth ride to be able to do that. So that's all we're doing. So I'm going to talk about photobiomodulation. This probably will not come to a surprise. It's a surprise to anybody in the room, but I'll say it really just to validate what you already know. Turns out it's not good for people when we spend most of our time inside a concrete building without windows. The access to the sun turns out to be a really bad thing, not having regular access. So modern humans, so somebody like myself, we have about a 97% decrease in sun exposure over our ancestors. That is massive because we photosynthesize, I'll say like plants, not literally like plants. They use chlorophyll to photosynthesize. We use other chromophores in our body to photosynthesize. We make about 1,400 different chemicals from the sun. We all know about vitamin D. There's a lot more. So we need access to light. So get out in the sun more. Great for you. What we're talking about here with photobiomodulation is using technology. So maybe Fran, you can be my model this time. So here's an example of some of our technology. So near infrared light in the helmet, put light into the brain. Here's another one. This is a wrap that you can put on the body anywhere. Today we're going to talk about what happens if you put it on the belly in a study that was done with autism. But you don't have to have autism to benefit from this. Any of us can benefit from it because we all have a light deficiency. So putting light on our body is going to help. So the science of photobiomodulation is simply saying putting light on the body and how that benefits our biology. A couple of the things that are going to happen for us, it's going to increase mitochondrial activity. So mitochondria produce the energy in the body, ATP that drives cells. That story is a little bit dated now, because our latest research tells us that although that happens, that is not really the big deal of mitochondria. The big deal of mitochondria is they actually are they are a fundamental communication system within the cell, between cells, between tissues, between organs and organ systems. So mitochondria are doing a lot of the work. So let's say in the brain, for example, if there's a brain wave, so Fran just showed you alpha waves, right? So those alpha waves, and they're starting in one place and they're going to another place. The mitochondria at the place those waves are going are already turning on and increasing energy and blood flow to have those neurons ready for those alpha waves that are coming. So we need our mitochondria healthy and functioning, so they're performing that role for us. Photobiomodulation, one of the main things that affects is the health and the function of our mitochondria. We'll also talk today quite a bit about the lymphatic system. So the lymphatic system is the lymphatic system of the brain, and it's the waste management system in the brain. Typically, our lymphatic system only turns on in deep sleep. So if our sleep is being affected and we're not getting good deep sleep, our internal, the garbage service is not running, we're going to get a buildup of catabolites in the brain, which can lead to sluggish processing, neural inflammation, think degenerative diseases like dementia, Parkinson's. These are buildup of plaques in the brain that break down the function of neurons and microglial cells and mitochondria. So super helpful for all of us to fire up our lymphatic system to help clearing it out, right? So one, a sleep issue can lead to that. Photobiomodulation will help turn on the lymphatics, but you don't have to be sleeping to have that happen. So it's a time that we can turn on this system other than when we're in deep sleep. So being able to turn on the lymphatic system, super helpful. So now we've got the lymphatics and we've got mitochondria as part of what's happening for us with photobiomodulation. So we're going to take a look at a result of a study done in autism. So here they laid out the participants, who they were. So what they did was they used a helmet similar to our helmet here, and they used a pad similar to that pad there. So the pad was pushed across the abdomen to do photobiomodulation for intestines. Primarily what they were targeting was the intestines. And so what we're trying to do there is, there's a number of things that we want to do. We want to reduce intestinal inflammation. So when our intestines are inflamed, they become porous, and waste materials, toxins that normally don't make it into our blood system can pass through an inflamed gut lining. So that's a problem, right? Because those they can move anywhere in the body. One, in this case, they can move to the brain. They can cause neural inflammation in the brain. And now we have a gut-brain access issue. So by reducing inflammation in the gut, we can help close the lining of the intestine. But it also has a profound effect on the microbiome, so the bacteria flora that are in our gut. They also need and benefit from light. So when we're clothed all the time, and here in Minnesota, right, there's probably almost no time that the sun is hitting your belly, right? So that's not getting any sunlight. So what we find is we get an overgrowth of the unhelpful bacteria and an undergrowth of the helpful bacteria. So just by putting photobiomodulation on the belly, we see that reverse. So the helpful bacteria flora start to come back and the unhelpful start to go down. So we have a number of functions that are happening here just in the gut that are overall positive for our well-being. But when we talk about gut-brain, we can think about those toxins or bacteria moving into the circulatory system and making to the brain there. We have a blood-brain barrier that keeps most things out. So the question for a long time has been, what's happening there? So it turns out those same toxins can travel up the vagal nerve and have a direct access to the brain. So they can go from the gut to the brain through the vagal nerve. So even more important that we have a way to try and stop that in the gut and address it in the brain, since we can't close down that pathway of the vagal nerve, right? We don't want to do anything to impair that. So this is what both the children and the adults were asked to do the treatment. Although not mandatory, the kids, it was mandatory to be in the study, to use the helmet and the belly pad once a day, relatively short periods, and on occasion twice a day. Here's a version of what it looks like.
How long do they use?
20 minutes in this, so it would be 20 minutes in the morning, 20 minutes in the evening, depending on their level of compliance with the protocol of the study. So some of the things that we just talked about in terms of what was going on for them. Here you can see the little graphic about the gut barrier and inflammation. So here's what we want to get to is the results. So some pretty astounding results, considering all they did was put light on the brain and light on the gut, and saw significant changes. And some of the things that maybe stand out are going to be like kind of the social inflexibility. So the child kind of doing what they were asked to do. Right? So that could be a challenge, all children. But in ADHD, it tends to ratchet up a little bit. So having that score go down for their ability to become more compliant is both helpful for them, but also turns out really helpful for the parents in terms of the parents' level of stress and anxiety and frustration. And again, as Fran mentioned, this is a closed system. These are not two individual. They're in a relationship. As either of them gets more frustrated, the whole process goes in a direction we don't want. As both get more well-regulated, it allows everything to become easier. Each person has a little bit more space, a little bit more bandwidth. So we have a positive spiral instead of a negative spiral. I want to get to this one, because I think just graphically it shows you. So this is this study that was just done. We're showing you this is an older study where photobiomodulation was done in just limited one small spot on the brain. So here they went to whole brain and belly, and you could see that the results here, just photobiomodulation, equal what we see as standard of care in a multimodal program. We're including medications, we're including support systems, where we have a really standard of care model, a robust model that is very comparable between just doing photobiomodulation gets us those same results, right? The amount of resources, the amount of effort, the availability to be able to match that resource intensive result, fantastic. So go to the highlights of the study. And then this is another one of my favorites here, which is looking at the parental scores and the parental stress level. And you see this massive drop that isn't echoed in any of the other studies and any of the other approaches. We see this really, really big drop. And so that's two-sided, right? So some of the parents did the modalities themselves, so they were getting all of those benefits, plus the positive change in their child. So you kind of have a dual effect, part of what brings this big change in the quality of life score. So very meaningful with a fairly low cost, low tech, low stress intervention to get such big results. So pretty much just summarizing everything that I've said so far about the study. Here again, just to say some of the benefits that are coming: increased mitochondrial activity, decrease inflammation, increase lymphatic clearing of the brain, which has a kind of an immediate effect. We get the short-term benefit of it, but there's also neuroprotective for the long term, right? So if we look at neurodegenerative conditions, we know that something like dementia has about a 30-year ramp. So you don't get dementia at 60, right? Or you start to show symptoms at 70. That didn't happen, right, at 65 that you got there. That happened back at 45. It was going sideways in the metabolism at 45 that leads to, say, dementia at 70. So by starting these kinds of habits when we're young, we're starting to build that neuroprotective aspect to our health that has effect over our life course. So these things are positive in the short term, but also highly positive over a life course. Also true for what Fran was talking about with the audiovisual entrainment. She mentioned heart rate variability. Heart rate variability is one of our best predictors of all-cause mortality. So it's a predictor of your resilience, your health over a lifespan. So the higher your heart rate variability, the better your health comes over the course of your life. The lower your heart rate variability, worse your outcomes are. So audiovisual entrainment, one of our best tools for optimizing heart rate variability. Again, better day at school, but also better health across a lifespan. So here we talk a little bit more about sleep. So sleep is so important to us. Across all domains, sleep is so important to us. So you can imagine, we can all know like the cycle, right? Whether there's a sleep issue, kind of organic sleep issue, it's a home environment sleep issue, it's a stress and anxiety sleep issue, it's a nutritional sleep issue. There's all kinds of reasons for us to have a sleep issue. Once it gets started, though, it becomes a cycle. Not sleeping well affects everything else. So when we come in with photobiomodulation and we're able to start regulating the brain function. And again, when we're going for the gut, if we can improve sleep, we get this massive downstream effect across all domains. So how's a kid doing in school? You can just think, if they're chronically sleep deprived, they have all of the issues. When you check off the list, they meet all of them. And they may not have any diagnosis at all. They just have sleep loss. And so this ability to affect the sleep cycle, again, with something that is non-toxic, no side effects, the body knows exactly what to do with it. It is just 100% nutrient. Absolutely great reasons to do it. So a little bit more kind of overall summary. So Fran talked about this a number of times, kind of the cascade that happens as our nervous system gets dysregulated. We lose access to our resources. There's a way we kind of like to say it in general. So whether that's our executive function, but it's also our autonomic nervous system's ability to regulate our body. So that could be temperature regulation, hormone regulation, blood sugar regulation, speed of our digestion, digest too fast, digest too slow. So these are our resources. As our nervous system gets dysregulated, we lose access to those resources. By using audiovisual entrainment or photobiomodulation or the combination, we do a lot of treatment where we use both. What it can do is restore that nervous system function, so we get access to our resources back, and all kinds of things across our world start to get better. So just a quick little synopsis of what we do in the clinic. So QEEG neuroimaging, neurofeedback. This is an example of us doing neurofeedback. Transcranial magnetic stimulation, transcranial alternating current stimulation, transcranial photobiomodulation. You see that happening here. The client is just kind of kicked back, snuggled in. The treatment is very passive on the neurostimulation side versus here. It's an active engagement model. And then over here, we see an example of the photobiomodulation, the glasses for the audiovisual entrainment. She actually has also a nasal laser in. So we're doing photobiomodulation that gets to the underside of the brain. So we're doing the top of the brain and the bottom of the brain. And then the audiovisual entrainment kind of coming in the middle, and our information. Any questions?
Is this something that the patient has to use every day for the rest of their life, or is it certain?
Sure. Great question. So I like to think about diet and exercise as models. So we might take on an exercise program for an acute reason. I sprained my ankle, so I have to go to PT and I do some exercise. But then after that, I don't do any more exercise. So the exercise was helpful, but you're doing it for an acute reason. Same thing for us. Somebody might have a traumatic brain injury. So they're doing maybe the audiovisual entrainment at home for a few weeks. They bring the device back. They say, thank you, I'm feeling much better. They're done. But we also know through nutrition and exercise that we should eat 3 healthy meals a day, every day for the rest of our life. And we should exercise 30 minutes every other day for the rest of our life. So same thing here. So there's the acute use, but then there's health maintenance. So optimally, a person would have an audiovisual entrainment device, and they would use it just like you might use a treadmill at home. Hopefully, when you use your treadmill at home. But you have a treadmill at home, and maybe you're the person who does 45 minutes every 3 days. Like, you're so much further ahead than doing 0. You could use your ADE the same way. I do 1 protocol every 3 days. Fantastic. Maybe you're a high user. You do 1 protocol every day. Love it. You're a really high user, super user. You do 2 protocols every day and 3 on Sundays. Fantastic. So think diet and exercise and everything you know about diet and exercise, and that's your model for these at-home neurotherapies.
Thinking of school setting.
Yeah.
Though too, kids and moving from one grade, one school up to another school, and the maintenance on something.
Certainly does. So school settings, I mean, they are tricky. The schools we work with, I don't know that any of them have implemented it in the same way, right? You just have to look at your population, your resources being your teachers, your teacher aides, your counselors, like whatever you have for resources, all of those things are going to vary. And so we have schools that have 1 device in the counselor's office, and it's used in acute situations, and that's it. Then we have schools who have it in their resource room. Students have access to it, so they can go by choice and do an ADE session. And then we have schools, especially some of our special ed schools, where all the students in the classroom have one, and they wear them off and on throughout the academic day. to optimize learning in the classroom and everything else, social skills. So there is no kind of one way that they get used.
But even having one treatment.
Absolutely.
will be
You can
long-term
do
effect.
the acute for that child that is dysregulated and they just need their system settled and find their center, and then they can go through their day. And so, yeah, so that type of acute use, absolutely. And there's definitely places that do that.
Yeah, like great for transition, right? Is that kind of what, yeah.
Yeah, so there's no kind of one right way. There's just what does that school have for resources to be able to implement?
And based on your knowledge of the student, you know, I have teachers that'll say, you need to go meditate before reading today, you know, and then the student will self-select. Students like it because, you know, they feel safe. It makes them feel calm. Some of them have never felt safe, you know, so.
Yeah, absolutely.
I
Okay.
use all of them. I wake up early and I put on my ABE and I give myself another setting 2.
Thank you, everybody.